We all know that conversations with patients who are taking opioids long-term for chronic pain can sometimes be challenging. Here are some principles to guide those conversations developed by clinical experts in the field, and some vignettes of these sometimes difficult conversations. As you watch these vignettes, keep these principles in mind. Keep the primary focus on outcomes patients care about. Redirect the conversation to focus on what patients can do to improve their quality of life. When discussing risk, focus on the drugs and the harm and side effects opioids can cause. Avoid backing the patient into a corner, and use shared decision-making to address patient concerns. Be your patient's ally by expressing empathy and support for their concerns and uncertainties.
Hello?
Mr. Anderson, this is Dr. Ralston. I've enjoyed getting to know you as a new patient over the past few months, and I'm calling you today about your lab test results.
Is everything okay?
I'm really not sure. The urine drug screen test came back negative, meaning there was no sign of your pain medicine in the urine.
Well, I forgot to take my medication the morning of the appointment, so that's probably it.
I was concerned about the accuracy of the test as well, and so I called the lab and asked them to run a second confirmatory test, which would have picked up any indication of this pain medicine in your urine over a longer period of time, and that test was negative too. In fact, I looked back through your medical record, and over the past couple of years, several of the urine drug screens have also been negative.
I hear that a lot of things can cause those tests to go awry. It's probably the supplements I've been taking.
You're right. So things like that can sometimes interfere with these results, but not with the second confirmatory test that I asked the lab to run.
So, look, doctor, I've done everything that you've asked me to do. I haven't called in early for medications. I haven't said that I've run out. And now it sounds like you're accusing me of something. I'm not a junkie.
I can understand how you feel that way, and I'm definitely not accusing you of anything.
It certainly sounds like you're accusing me.
I have to be careful with these prescribed medications because they can cause serious problems for some patients, addiction and sometimes even death. And I have to be clear that the medicines I'm prescribing are not causing any problems for someone because I'm responsible for the consequences. And that kind of thing really keeps me up at night.
So what are you telling me, doctor?
So let me just be honest with you. These are dangerous medications. So I have to be totally confident that I'm not causing serious problems for someone else. Since I cannot be 100% confident in this situation, I cannot continue to prescribe this medicine for you. I do want you to know that I am concerned about you as a patient and about your pain. Can we schedule a follow-up appointment in a week or so we can talk about other options for your pain?
It doesn't sound like you're very concerned about my pain, doctor.
I can understand how you'd feel that way. You just got a prescription from me. You should have enough pain pills to last you for another week or two before you come back in. And then let's talk about other options for your pain.
It sounds like I don't have a choice.
I'm sorry I can't prescribe this medicine for you any longer, and I know this is an awkward situation, but I really value our relationship, and I want to continue to work with you on your pain.
Okay, maybe I'll see you in a few weeks. Goodbye, doctor.
We hope these vignettes and principles will be helpful when you encounter these difficult conversations with your patients. Thank you for your time.